Hi guys, Dr. Thompson here with Exemplify Health Center, and today I want to show you some exercises that we want you to do at home in regards to the shoulder. And the first exercise we want you to do is going to be some lacrosse ball mobilization. Now, thing about the shoulder is that when there's a problem with the shoulder that you're feeling here or you're feeling in through the rotator cuff, the main problem is not where you're feeling the issue, it's actually within the shoulder blade. And so if we can get the shoulder blade to move properly, that when we move it, the shoulder blade will rotate out of the way so that this tissue that's underneath the shoulder blade will stop getting pinched all of the time. So the first thing we have to do is start to get the shoulder blade moving correctly. And so we have to start reducing the scar tissue and a lot of the adhesions that are there due to chronic poor posture or previous injuries. So when we do this, we're going to be laying down on the table, but I want to show you so where you know where to put the lacrosse ball when you start. The first one is going to be on what's known as the levator scapula muscle, and this muscle is on the inner uppermost part of the shoulder blade, and it actually goes all the way into the top of the neck. So the first place that we want to put it is right in through that area, and if you're unsure where you should put it, before you do any of these mobilizations, it should actually hurt a little bit. You'll feel an area that's a really tight band or muscle spasm, and if it hurts, then you know you're going to be in the right spot. So the first one that we're going to do is we're going to put it on that levator scapula, and we'll apply pressure when we're laying down, and then Kelly's going to flex and extend the shoulder as much as possible. Now this is going to hurt, but don't worry, it will get better. So we want to do this each 10 times. So that would be 1, that would be 2, that would be 3, and so on. Then what we're going to do is we're going to go down the shoulder. We're going to find another area. This is called your rhomboids. These rhomboids help to pull the shoulder blade closer to the spine. So the rhomboids actually go from here to here. So what we're going to do is we're going to place it within that rhomboid, laying down, and now we're going to horizontally adduct and abduct the shoulder. We're going to do that 10 times. We're going to move it down a little bit further, do that 10 more times, and then move it down to the bottom of the shoulder blade, do that 10 more times. So in the middle of the shoulder, you're going to do it for a total of 30 times. The next thing that we're going to do is we're going to work on the actual rotator cuff muscles. So you're going to find this spot of the rotator cuff, and it will be a very tender spot. We're going to put that ball right there, and we're going to internally and externally rotate our arm to pressure. And again, you want to do this 10 times. So this would be 1, 2, 3, and so on. And the last area that we're going to use with the lacrosse ball is going to be what's known as the pec minor muscle. And this muscle actually attaches from your rib cage into your shoulder blade, which actually comes into here. So what Kelly will do is we'll apply that pressure. Usually she'll have to lean against a doorway. And then while she's doing that, again, she's going to flex and extend her arm, and she's going to do that 10 times. So let's show you what that actually looks like. Okay. All right, so the next exercise that we're going to do involves a PVC pipe, and these are called shoulder dislocates. And you can get a PVC pipe that's about 5 feet long, or a broom handle that's going to be approximately 5 feet long, so that you're able to do these exercises. The first one's called a shoulder dislocate. So Kelly's going to go ahead and she's going to grab it at a distance. She's going to keep her arms straight, and she's going to elevate her traps, and then she's going to bring, with her arms staying straight, She's going to bring it all the way around to the back and all the way around to the front. So she's going to do that for 10 times. Now, if that's easy and as that gets easier, then what she's going to do, she's going to narrow her hands a little bit more, and then she's going to elevate and keep those arms straight, and then do that 10 more times. Now, what you want to do is you want to go to basically the narrowest as possible without bending your elbows. So let's see if you can do it a little bit less. And then she's going to elevate and go all the way back. So you want to find that narrowest position that you're able to do, keeping those elbows straight and keeping good form. So this is called shoulder dislocates. All right, the next exercise we want to do is to help improve your internal and external rotation with your shoulder using this PVC pipe or this broom handle. So the first thing we want Kelly to do is to work on what's known as external rotation. So she's going to go ahead, she's going to grab this PVC pipe on her affected shoulder, and she's going to bring this up just a little bit, and she's going to take this PVC and then with using her other arm, she's going to try to pull that arm down like this and go as far as possible. And she wants to hold that position for 1 to 2 minutes. Now, one thing you want to make sure that you don't do is don't lean backwards like that. You want to keep the abs braced and only work on trying to extend the arm and not trying to extend the back. The next exercise involving the PVC or the broom handle is going to be working on internal rotation. So Kelly's going to use this for her right shoulder. So basically you're going to take the affected arm and you're going to go ahead and grab onto that PVC pipe, bring it behind your back. Your other arm is going to pull up as far as you can, and then once you pull up, you're going to pull down, and that's going to cause that arm to internally rotate, and you're going to try to go as far as possible, and you're going to hold that for 1 to 2 minutes. All right, the last exercise that we want you to do for the shoulder is once that you have worked on warming up those tissues and increasing the range of motion, we want to do some things to help strengthen it. This is a piece of TheraBand, very inexpensive to get. The exercise we want you to do is called band pull apart. She's going to take this and she's going to hold on to it. The first thing that she's going to do is she's going to set her shoulder blades back and down, and then she's going to try to pull that band apart in a slow, controlled motion. Now, not only can you go straight horizontal, but then you can mix it up a little bit and go up and down this way. And so these are called band pull aparts, but a lot of times people ask me, how long do you want to do it for? And you should do it until it burns and then do a little more. So this one is called band pull aparts using a very inexpensive piece of TheraBand.